Hi, my name is Dr. Brandy Ross, and I am here today to talk to you about informed choice, what it is and why you should care about it. Informed choice is a little different than informed consent. Informed consent means that you've received information about a test or a procedure, and you now agree to it. But did you really receive all of the information you need to make a decision? You likely received enough information to make you feel comfortable saying yes or consent to the test or procedure. But did you get information on the other side? Did you get information that may have made you say, should I get this test? Informed choice means that you got information on the risks of doing something as well as the benefits. You can't truly make an informed decision without this balanced viewpoint. For example, let's talk about gestational diabetes screening. If you've been pregnant before, it was likely assumed that you would drink this sugary, flat, soda-like drink and have your blood drawn because you want to know if you have gestational diabetes, right? That would be a good thing to know. Knowing can help prevent some complications of pregnancy and birth. But did you know that there's a false positive rate of 12 to 15% with this screening? That means that 12 to 15% of people who screen positive will go on to do further testing with a bigger dose of the drink and will already be labeled as gestationally diabetic. This label will follow a person through every pregnancy, regardless of how much they've changed their lifestyle factors. And you can change these factors with diet and exercise. To continue with this example, you also need to know what the risks of having gestational diabetes are. The biggest risk, and I'd say the most common risk, is a big baby, which has potential complications on its own. A bigger baby may have more challenges being born. There can also be risks with baby's blood sugar after birth, which may result in a baby being sleepy and difficult to feed. These complications are relatively small and can be mitigated in the hands of a skilled birth attendant. But many times, we are just told that having gestational diabetes is bad, and so you should do the test. So, given all of this information, and this is not all of it, there is definitely more, you may elect to go ahead and do the test, or you may decline. But isn't it nice to have a choice? Isn't it nice to be able to make a decision based on good evidence and not fear-mongering tactics? Having the additional information just helps you make a more informed decision. When you have a provider that gives you true informed choice, you are also less likely to be made to feel guilty for declining or continually being bombarded with the choice you made. Informed choice supports a person's medical autonomy. The definition of patient autonomy is the patient's right to make decisions about their health care without their provider trying to influence their decision. Medicine has become such a litigious field that many healthcare providers feel they know what's best for their patients, and they stop giving them informed choice, and they take away that autonomy. But this is not the way medicine should be practiced. Everybody should have informed choice. Would you want the ability to make medical decisions taken away from you? How much control do you want over how your pregnancy is managed or how your baby is born? If you find that your provider is not giving you informed choice, it's up to you to ask the questions and gather information to make a decision. Or you can find a different provider. Thank you for watching. Visit me at www.moonrisehealth.com to learn more and watch out for more videos. Have a great day.